Hello and welcome to the topic Introduction to Head Injuries in the Surgical module. Depending on where you undergo your housemanship training, your exposure to the management of head injuries may differ. Nevertheless, one should have a basic understanding of head injuries and the principles of management in order to be able to deal with patients who come in with various degree of head injuries at your center. By the end of this topic, you should be able to describe the types of head injuries, discuss the causes of head injuries, explain the clinical manifestations of different types of head injuries, and finally, outline the approach to head injuries in terms of investigations and management. Let's get started. Head injuries are one of the most common causes of disability and death in adults. The injury can be as mild as a bump, bruise, or cut on the head, or it could be moderate to severe in nature due to a concussion, deep cut or open wound, fractured skull bones, or from internal bleeding and damage to the brain. Head injuries are divided into concussion, skull fracture, and intracerebral hemorrhage. We'll be looking into this one by one. Starting with concussion. A concussion is an injury to the head area that may cause instant loss of awareness or alertness for a few minutes up to a few hours after the traumatic event. Next is skull fracture. A skull fracture is a break in the skull bone. There are 4 major types of skull fractures. This includes linear skull fractures. In a linear skull fracture, there is a break in the bone, but it does not move the bone. Next, we've got depressed skull fractures. In this fracture, part of the skull is actually sunken in from the trauma. Diastatic skull fracture. The sutures are the areas between the bones in the head that fuse when we are children. In this type of fracture, the normal suture lines are widened. These fractures are more often seen in newborns and older infants. Lastly, we've got the basilar skull fracture. This is the most serious type of skull fracture, and it involves a break in the bone at the base of the skull. Patients with this type of fracture frequently have bruises around their eyes and a bruise behind their ear. They may also have clear fluid drainage from their nose or ears due to a tear in a part of the covering of the brain. Moving on to the next is intracranial hematoma. There are different types of intracranial hematoma as follows. Firstly, epidural hematoma. This occurs when a blood clot forms underneath the skull but on top of the dura. Usually it comes from a tear in an artery called the middle meningeal artery. Next, we've got the subdural hematoma. This occurs when a blood clot forms underneath the skull and underneath the dura but outside the brain. These can form from a tear in the veins that go from the brain to the dura or from a cut on the brain itself. Then we've got contusion or intracerebral hematoma. A contusion is a bruise to the brain itself. A contusion causes bleeding and swelling inside of the brain around the area where the head was struck. Bleeding that occurs inside the brain itself is also called intraparenchyma hemorrhage, and this can sometimes occur spontaneously. When trauma is not the cause, the most common causes are long-standing high blood pressure in older adults, bleeding disorders in either children or adults, or the use of medications that cause blood thinning or certain illicit drugs. Lastly, we've got diffuse axonal injury. These injuries are fairly common and are caused by shaking of the brain back and forth, which can happen in car accidents, from falls, or shaken baby syndrome. Diffuse injuries can be mild, such as those with concussions, or it may be very severe, as in diffuse axonal injury. In diffuse axonal injury, the patient is usually in a coma for a prolonged period of time with injury to many different parts of the brain. Next, let's move on to the causes of head injuries. There are many causes of head injuries in children and adults. The most common traumatic injuries are from motor vehicle accidents, such as automobiles, motorcycle, or struck as a pedestrian, from violence, from falls, or as a result of child abuse. Subdural hematomas and brain hemorrhages, called intraparenchyma hemorrhages, can sometimes happen spontaneously. But what causes bruising and internal damage to the brain? When there is a direct blow to the head, shaking of the child as seen in many cases of child abuse, or a whiplash injury. This is seen in motor vehicle accidents. The bruising of the brain and the damage to the internal tissues and blood vessels is due to a mechanism called coup contre coup. A bruise directly related to trauma at the site of impact is called a coup lesion. As the brain jolts backwards, it can hit the skull on the opposite side and cause a bruise called a contre coup lesion. The jarring of the brain against the side of the skull can cause shearing or tearing of the internal lining, tissues, and blood vessels that may cause internal bleeding, bruising, or swelling of the brain. Now let's move on to the clinical manifestations of different types of head injury. Each individual with head injury may experience symptoms differently. Symptoms may differ depending on the type of injury. In mild head injury, you've got superficial swelling of the scalp, confusion, headache, nausea, and vomiting. Whereas in moderate to severe head injury, this requires immediate medical attention, and symptoms may include any of the above, as seen in mild plus loss of consciousness, seizures, and/or coma. Diagnostic tests for head injuries may include X-ray. A skull X-ray may show fractures, and this is extremely crucial for immediate attention as many warrant neurosurgical intervention soon, especially in basilar skull fractures. Next, you've got a CT scan, and this helps in delineating brain parenchymal injury seen in contusion and bleeding in the brain. Lastly, you've got an electroencephalogram, an EEG. This is sometimes done if patient persistently develops seizures post-stabilization and surgery to further understand the areas of brain that has scarred. These group of patients will require lifelong anticonvulsant therapy to prevent future recurring seizures. Head injury treatment will be determined based on the patient's age, overall health and medical history, the extent of the head injury, the type of head injury, the tolerance for specific medications, procedures, or therapies, expectations for the course of the head injury, and your opinion or preferences. Depending on the severity of the injury, treatment may include ice, rest, topical antibiotic ointment and adhesive bandage, observation, immediate medical attention, stitches, hospitalization for observation, moderate sedation or assistance with breathing that would require being placed on a breathing machine or mechanical ventilator or respirator, or surgery. If the patient has severe head injury, he or she may require monitoring for increased intracranial pressure. Head injury may cause the brain to swell since the brain is covered by the skull. There is only a small amount of room for it to swell. This causes pressure inside the skull to increase, which can lead to brain damage. Intracranial pressure is monitored while the patient is under observation using a device. Neurosurgeons typically decide the need for surgery based on the type of brain injuries and severity. That is all for this topic. Thank you for your time.